Hey, Cozumel community and Cozumel4You. I'm Laura from Cozumel4You, and I have with me right now Dr. Silvia Alvarado. She is a specialist in orthopedic and traumatology. And we're going to talk a little bit and ask her some questions, especially some that the Cozumel4You readers sent in, because lots of expats that live here on the island. I think there's about 6,000 of us, something like that. Even more when you count snowbirds and tourists. And a lot of people wonder what medical care is like in Mexico, and specifically Cozumel. So if you need to get an appointment with Dr. Silvia, you can just call the main board of CMSA, which is 872-9400. Okay, so say I'm an expat and I suffer an injury while traveling or playing sports. What immediate steps should I take before going to the emergency room?
First, I recommend go to the hospital, emergency room, because we need to evaluate the lesion and the situation first. And maybe if it's an injury, a fracture could be. The first step, I think, it's pain control. And then start with the evaluation, yeah? Because we have to maybe take some x-rays or maybe do a specific evaluation for the lesion that the patient present.
Mm-hmm. And all of the treatments that you're doing, they're exactly probably the same as any emergency room would do in the United States? There's not a big difference between an ER here at CostaMed and the US?
No, I don't think so, because the attention could be the same. Because it's maybe an accident, so you have to go immediately at urgency, okay?
Okay, so you're going into the urgency.
Yeah, that's it.
And that's where you are, right?
Yeah.
So, like, you would probably be one of the first people I would see, like, if I hurt my hip or broke my leg or something like that.
Yeah, you must go at emergency room, yeah.
Okay, and this next question is actually from one of the Cozumel4You groups. They wanted to know, when do you know if you need a hip replacement?
It depends on the situation, because there's some people that starts with some pain, could be, but the person could still with the normal activities. So this kind of patients maybe need an evaluation, maybe take an x-rays, maybe painkillers or something like that to improve the pain or the symptomatology, okay? And there's another kind of person that maybe it's too much pain, maybe they took some physical therapy, painkillers, and
it's not working.
Yeah, it's not working. Maybe we need to evaluate the situation, and then with x-rays, with some specific studies, evaluate the hip replacement or the knee replacement, because it's not the first step in the treatment. So before the replacement, we have too many options.
And I can get a hip replacement right here?
Yeah.
At the hospital?
Yeah.
Okay. Another one of our readers asked about before you get a hip surgery, there's a host of different procedures, and one of them is doing like a steroid and an anti-inflammatory injections.
Yeah.
Is that also you or in orthopedics?
Yeah, we can do it, but if there's the case that the patient needs this injection with steroids, could be the same. We need to evaluate the situation, and then because there's steps before the injection, we have to try with oral medication, and then if it doesn't improve, maybe the injection. And the injection, we need to evaluate the space in the joint, maybe, and the possibility of do the injection with an ultrasound, because it's a space that we have to found with the nail. So the recommendation is with ultrasound.
So you do like that's exactly what the anonymous reader wrote. Now let's talk about, I have a problem. I have a trauma. I've broken my leg.
Yeah.
You work in the ER.
Yeah.
So I broke my leg and I probably need surgery to repair it. Let's talk about the steps that I'm going to go through from the beginning of the hospital to when I leave.
First, we have to evaluate, and we have to take some blood test, maybe electrocardiogram, X-rays of the lungs, thorax, and evaluate the situation of the person. If it's compatible for the surgery, we need to do the surgery if it's recommended, because we need to improve the functionality of the patient. And sometimes if we cannot do the surgery, the person have to stay at the bed 2 or 3 months. That it's not recommendable for the old person. So if it's possible, do the surgery. Yeah.
And I can get that done right here at the hospital.
Yeah. Mm-hmm.
Okay. And if I get the surgery,
Yeah.
then I can also do my physical therapy here?
Yeah, we have a department of physical therapy that can help you for the for recovery, the functional step by step.
So all my aftercare can be here at the hospital too?
Yeah. Mm-hmm.
Okay. And again, if you want to start and make an appointment with Dr. Silvia, all you have to do is call 987-871-9113. And then the last topic, which really isn't your specialty,
Yeah.
but is U.S. insurance or Canadian insurance, or what happens if I get injured? Will my U.S. insurance cover any of this?
We can help you here in CostaMed, because we have a specific department that can help you for this insurance. We do the part of the treatment, but we have people who can help you for this kind of problems about the insurance. So don't worry about it.
And then again, another question was about getting injections into your knee.
Yeah.
Steroid injections.
Yeah, it's more easy than the hip. We can do it without the ultrasound, the injection. And it's the same medication, improves the symptoms, but the same. We have to try with oral medication, maybe physical therapy, maybe with some other options before the injection.
Okay. And then the last one is if I have, say, carpal tunnel syndrome, would an orthopedic person like you be the one? Would you do the injections in my hands?
Could be, but the same with ultrasound, because the joint is small.
Okay.
Yeah, so it's better with ultrasound. Mm-hmm.
All right. Well, that's all the questions. So thanks, Cozumel.